Welcome to the Bamboo Parenting Podcast. My name is Kayla. I'm a psychology researcher,
And I'm Leah, a practicing psychologist.
and we are joining you on beautiful Bindal and Woogarugaba country in Australia. We interview experts on self care, infant care, and relationships. In this episode, we talk to Dr. Rebecca Schlafer, who's been serving as the research director for the Minnesota Prison Doula Project since 2010. This project provides prison based pregnancy, birth, and parenting programs and are now being developed and implemented in 8 states throughout the USA.
They aim to support mothers while exposed to the criminal legal system, to nurture healthy relationships and increase parenting confidence and their skill set. We chat to Rebecca about the incredible pregnancy and postpartum programs, social inequality, and the need for community based programs to support parents and their families when transitioning from incarceration. We hope you enjoy.
Hi, Rebecca. We're super excited to have you on the podcast today. Thank you so much for joining us, especially that it's your evening. How are you doing?
Good. Thanks so much for having me.
So, we'll just dive right in to hear a little bit more about the work that you do with the Minnesota Prison Doula Project, and maybe you could tell us a bit about your role there and what the goals of the program are.
Yeah, sure. I'm happy to. So, I have been partnering with the Minnesota Prison Doula Project since 2010 when the project had their first birth. The Minnesota Prison Doula Project started at our state's only women's prison. And what we do through the Minnesota Prison Doula Project is provide group based and one on one birth support. So, group based prenatal education and postpartum support. And then one on one prenatal education support, both during the prenatal period when pregnant people are transitioned to the hospital for labor and birth, and then postpartum support, both at the time they're separated from their infants and they go back to prison, and postpartum support back at the prison. And so my role has been to really, in my role as a researcher, really been helping the program collect data, understand all of the ways in which participants, doulas, the prison in some respects. So we've done some studies with corrections officers, caregivers, sort of trying to think about all of the ways in which we can learn about how this project is impacting different kinds of people, and most importantly, the pregnant and postpartum people themselves.
That's so interesting. And what is the research telling you?
Yeah, I mean, so I think one of the things that we were early on just trying to understand is like, is it feasible to do doula work inside of a prison setting, right? We were reading about work that was similar in other parts of the world. The United States has a unique context in that we have the unfortunate distinction of incarcerating more people than anywhere else in the world. And we have seen skyrocketing rates of maternal incarceration, particularly over the last 30 years. And so I think one of our earliest questions was like, is it possible to take this community-based intervention that requires accessibility and information and touching and what does this look like in a prison setting? And so early questions were about feasibility and acceptability, really, right? Do these moms inside want this service? And we've learned, of course, over many years now that this is filling such an important gap, and that the health services that pregnant people receive inside prisons and jails in this country is really failing in a lot of ways. Much has been documented about the lack of quality of care, and then some of the care and treatment generally being of low quality and not to community standards of care. And so I think for us, we've been trying to better understand the ways in which doulas can support pregnant people, even in the context of a system that can be harmful in some respects, right? So we learned a lot, and we are now really in a place where we're looking to see what other states are doing, and particularly thinking about adaptations to this model in other parts of the country and really the world.
Excellent. And because you have sort of touched on other states, what have you noticed? Maybe you could tell us a little bit more about those enhanced programs that are accessible across different states. And what are some of the differences or similarities that you're noticing in these sort of differing environments?
Yeah, it's such a great question. I mean, I think that what's so interesting about the United States, right, is that we have mass incarceration across the country, but we also have tremendous variability across states in terms of just the sheer number of women that are incarcerated in different states. And so, in some of our southern states where maybe criminal legal system policies are more intense and people go to prison for longer periods of time, we have much higher numbers of pregnant people in those facilities, right? And also really interesting context, I think, now in the overturning of Roe v. Wade, where we also are seeing that people's access to reproductive rights like abortion care has been severely limited in many states, right? Most of the states in the country. And so you sort of juxtapose this, like, people can't get reproductive health in the community. There may be more pregnancies, particularly among women who have multiple forms of marginalization. And so we see some of that variability happening in terms of just who the sort of client population is, larger numbers in some states, and then really profound racial and ethnic disparities depending on sort of where in the country we're looking. We have a very high Indigenous population in our state's prison. That's really not the case when we look at states like Alabama or Georgia.
If we were to look at, so Minnesota, you said that it's the only women's prison that the doulas are working at. Like, how many inmates are there?
Yeah, that's a great question. So in Minnesota right now, I would say that our average daily census is probably around 600. Our program started in the state prison, but has expanded to county jails all across the state. And so the program will take referrals from any county jail. And there are 87 county jails in the state of Minnesota. And the Minnesota Prison Doula Project also helped launch the Alabama Prison Birth Project. So there is a similar program in Alabama, and they're now all sort of under this umbrella called the Ostara Initiative. On any given day, we may only have a handful of women who are pregnant, but a growing number who are giving birth in custody, and certainly different than what we were seeing 30 years ago.
I think it was very interesting when you were talking about the sort of cultural, ethnic disparities in different states. And in Australia, about a third of women in prison are Aboriginal Torres Strait Islander, which is obviously massively disproportionate to the overall population. I'm just wondering if these programs are tailored yet to be culturally sensitive, or if this is something that you're looking into.
We've really been working over the last 10 years to have a workforce, doulas and program staff that reflect the identities of the people who are in our program. So we also have a disproportionate number of Black women who are in our state's prison, and really that is the case across the country. And again, historical structural racism that has driven tremendous disparities in who gets wrapped up into this criminal legal system here. We have worked to really diversify the staff on our team and really try to honor individual and cultural practices that people bring to the birth work. And so that looks different for different people. I would say that the doula program isn't tailored to specific racial or ethnic groups, but really has worked to take an individualized, meet the client where they're at approach, and be really truly reflecting over the course of more than a decade in terms of our own positionality and what we bring to this work, and continue to operate from a place of cultural humility and learning with each step, recognizing that there's a number of differences between my experiences and my positionality as a white middle-class woman with a PhD that is very, very different, not just the race, ethnicity component of the clients that are being served through the doula project.
Amazing. And anecdotally, or from some of that preliminary research, do you find that there is sort of distrust from those marginalized groups in engaging with these programs?
I think sometimes there's hesitancy. Like, a lot of people don't know what a doula is, right? They don't quite know what they're going to get into. And I think for moms who are coming to prison for the first time or identified as pregnant when they get to prison, that is a scary and uncertain time, right? And in a space that they can understandably be weary. I think it helps that our staff are not employees of the Department of Corrections, right? We don't work for the DOC. I always tell people, like, I don't work for the DOC. I'm here to talk to you about your experiences. I think that helps. We have very, very, very few people over the course of the last 14 years who have turned down a doula. And I think the clients get a sense of, like, who are the doulas? Who was your doula? What was your experience like? And they would say uniformly, we've heard from clients that this has just been an incredibly beneficial experience, and that having a doula there really made the experience a little bit more bearable.
That's so good. It's so very interesting. I was wondering if you could just explain for our listeners at home, like how the program works. Like I was thinking through it. Do you get a one doula and they stay with you through your whole pregnancy? Obviously, you arrive at prison and then you're introduced to the program. But what are those next steps, and how are the doulas supporting those inmates throughout their journey?
Yeah, that's a great question. So in most places, most prisons, what happens is when new admissions come in, those individuals are screened for pregnancy, typically up to about age 55. And if somebody is identified as pregnant, then they are in Minnesota referred to our parenting coordinator. And that is a staff person that works for the Department of Corrections. So it's at that point that in our state, the parenting coordinator meets with the pregnant person and explains sort of the processes that will happen with the prison and what they can expect, right? They talk about whether or not that person has plans for where their baby will go, how long until they get out, sort of how this fits into their case plan while they're in prison. And then talks about the doula program, sort of what is a doula, and invites them to participate in the weekly support group. And so they can immediately begin the weekly support group. And that's a nice opportunity for clients to come and meet other pregnant people, meet postpartum people, share stories, and get support in that group setting. And it's through then that they will also be identified as sort of matched with a doula. And we do a one-on-one match between a doula and a client who will follow them throughout their pregnancy. Our doulas aim to meet with pregnant people at least twice during the prenatal period. They're called to the birth when the person is transferred off-site, off-grounds, to the hospital for labor and birth. And so the doula will meet them at the hospital and be there for continuous labor and delivery. And then the doulas come back at the time of hospital discharge and provide support during that critical period when moms will be separated. And then our doulas aim again to have 2 postpartum visits back at the prison at least. And remember that all the time that they're having these one-on-one visits, they're also getting to participate in the group-based support.
That's incredible. I'm very interested in that sort of transition. So once the mum has given birth, and that can obviously be an extremely traumatic process with the child being taken away. So in Australia, I think in all states except South Australia, it doesn't mean that it's sort of across the board accessible, but we do have some programs that allow mums to remain with their child. So their child lives with them. In Victoria, I think it's called Living with Mum program, and up to around school age, depending on what you're incarcerated for, the child can remain with the mother. It allows the mum to be really involved and raise their child for at least, maybe 3 to 5 years. That's obviously not accessible in many, many countries. It's not even widely accessible across Australia. So I thought maybe we could hear a little bit more about what you're hearing from mums about that experience of having their child removed, or what is available to them after birth.
Yeah, I mean, I think that separation visit remains one of the most painful experience I can't even imagine, right? It is so excruciating. And even just to read the doula's narratives of how those separations go, or to hear moms' written reflections on their sort of post-birth surveys, it's heartbreaking. This is a deeply painful time, as you can imagine. And in Minnesota, we don't have a residential program like the prison nursery program would. There are 8 states in the United States that have prison nursery programs. Our state has really been looking at ways to release pregnant and postpartum people rather than bringing babies inside, really working to think about releasing moms into community. And so in 2021, our state passed the Healthy Start Act, which permits our Commissioner of Corrections to release pregnant and postpartum people into community-based alternatives for up to 1 year. And I think one of the things that we've struggled with here in the United States, and even in the literature, sort of the international literature around prison nursery programs, is that the evidence and the clients who end up participating in prison nursery programs are most often some of the most well-positioned moms, right? They are the moms who have the shortest sentences, or the moms who have the lowest level crimes. And I think when we were looking at prison nursery programs in Minnesota, the thing we really needed to ask ourselves is, would most of the moms get to participate in this program, right? And so some of the challenges that we're having now with the Healthy Start Act are similar to what other states are encountering, right? It's this eligibility criteria, and that most moms are not getting to participate. Those that are, we question, like, shouldn't they just be out in community? And then those who aren't, I think it's a question of like, well, what are the other services and supports that they need? If on one end there is an open door release into community, and on the other end it is you're separated indefinitely from your baby, sort of what are all of the policy solutions in between? And how do we consider what moms may need in terms of housing, substance use support, mental health treatment, social support, safe childcare? These are the kinds of things that I think are the services that prison nursery programs offer, that we have to think about, like, how do we recreate those things in community? The underlying social conditions that got a person to prison pregnant haven't changed just because we've released them. They are still homeless. They still have an active substance use disorder. They still have an ongoing mental health crisis, or some combination of those things. And so I think the challenge that we all have to, I think, face in terms of like, how do we address reducing this horrific harm of separating moms and babies, is really trying to figure out, well, what do moms need to be healthy moms, and what do they need to be a healthy dyad? And I'm not sure that prison is ever going to be the place that can create a really healthy home for mom and baby.
I was wondering when, if you could just explain, like, who then takes the baby? Like, how do we decide where the baby goes once mum's, been separated from the child?
So it's really interesting. And this was one of the things that just stunned me 15 years ago, was like, wait, what happens? There is really no formal process here for transitioning care and custody. Essentially, what happens in most states is the mom says, I want my kid to go with my mom or my sister or my auntie. And that person comes to the hospital and picks up the baby and leaves with the baby. And there is very little oversight, involvement, support. It's really challenging. I mean, I think on one hand, I really want families to be able to thrive and not have government intervention, and have people like kind of have the long arm of the criminal legal system or the child protection system kind of looming over them. And yet, right, I think really hard to imagine if my sister called me tomorrow and said, you're going to have to come pick up my baby. I don't know what I would do. And I'm a pretty well-positioned, well-resourced person, right? But the challenge of taking on a brand new baby, I think, is hard to imagine. And I would just say, right now, very little systematic, structural processes that address the need. So it is often a relative caregiver. In about 25% of cases or so, they're going immediately into child welfare services, right? Child protection, county services that will be responsible for the care and custody until they find a foster home. But I think we know very, very little about what happens to those babies nationally. And I think we know very little about what happens when they start with their first caregiver. A colleague of mine is doing a fabulous dissertation right now. She's a graduate student at Harvard, Bethany Kotler, who's working on a project looking at the transitions in care for babies. So when they start, as soon as they are transitioned at the hospital, discharged, sort of how many moves do those kids go through in the first year? And the caregiving instability is really troubling. And I think perhaps not surprising given the level of like precarity that these families are experiencing, and the challenges of raising a newborn when you have no structural supports to do so.
Yeah, in Australia, it's a really high, I think it's close to 50% of incarcerated mothers who then become separated from their children, were separated from their parents. And so I would think it's very similar in the US and many countries, where the expectation that that grandparent or aunt is going to be in a position to provide high quality parental support to that child is very unlikely, which is just really sad.
Yeah, and then you just see intergenerational patterns of separation and
Yep.
trauma.
Absolutely.
It's so amazing that your colleague's going to be, looking into what happens to these children, because until we shine a light on it, nothing's going to change.
Right. And I think critically, like, what are the supports that those grandparents need? One of the studies that we had done years ago was just to try to understand where are the babies placed, right? That wasn't even systematically understood. And so to go back through these records to try to understand who picked this baby up from the hospital, right? It seems so
Wow.
basic. And yet there's so little attention paid to this population. And I think that's something that I think there warrants a lot more work.
And I suppose if you're struggling to find out where the baby is when it's released from the hospital, where does it go? Like, is there a chain of, paperwork to say that it moved from grandma to auntie to another auntie or wherever it does go, and where does it end up?
Right. And I think in many respects, great to have a whole wonderful large family who can help provide care and support. And I think important for us to recognize the value and potential strength in having family members who can support. And also, we know that babies essentially need a primary caregiver, right? They have to develop a secure attachment relationship with a single or one or two primary caregiving relationships, and how, decades of work have told us that congregate care or unstable care is really bad for attachment relationships and long-term health and development.
And what do we know about children coming to visit their incarcerated parents, about that process and how that
Yeah.
impacts both the parents and the children and the caregivers in the community who are trying to support that relationship?
The visiting environment and the visiting policies and processes are so different facility to facility. Even in our state's Department of Corrections, the facilities themselves are so very different. And as a result, I think it's really hard to know, kind of on the whole, what we mean when we talk about visiting. I think there is a growing body of evidence that has sort of talked about in person visiting, right? And the benefits of in person visiting, being able to hold your baby, to be with your baby, the sort of developmentally appropriate parts of physical contact and visiting. And then more literature that's coming out, particularly because of COVID, and what virtual visits can offer. From my vantage point, thinking about for older kids and adolescents, virtual visits may be great, right? If I had to come to Australia to do this podcast, we probably wouldn't be doing it, right? There's a beauty in being able to connect in this way. That's not the same for a baby. What we do know generally is that the visiting environments were not designed for moms, particularly with young children. So our moms, for example, can't nurse during visits. They wouldn't be able to pass a baby back and forth during a visit.
Do you know anything about if children are taken into custody, like placed with the foster parent or that sort of thing, so not like kinship sort of care, around how they can access, visiting the parent? Is that something that's broadly made accessible, or is it something that would be uncommon or difficult to achieve?
Yeah, it's a great question. We've been working really hard to help foster parents, well, but really child welfare workers understand that, like, if there's an active case plan, they really need to be supporting visits. That's actually part of the case plan, and it's critically important. So I think it really depends on sort of where geographically the baby is placed. We do have some phenomenal services here in Minnesota and similar things in other states where we have a fabulous program here called Together for Good. And these are host families. This is not child welfare involvement. They do not take any government intervention, money, etc. They really, truly, they live mostly locally to the facility, and they are willing to take temporary custody of babies and commit to bringing the babies to at least weekly visits. And also then when moms get out, right, are there to support this transition with moms upon reentry, and will sometimes provide babysitting or respite after mom has resumed caregiving. So it's really this just like beautiful alternative to foster care. And I think one very cool model in which we could think about supporting incarcerated moms and their babies, and really supportive visiting.
That is incredible. And I love that idea that they can still be, if the child has formed attachment to this person or family, they can then continue that relationship even when the mum,
Mhm.
leaves prison.
Mhm.
That's really wonderful work.
Yeah, it's awesome.
So if we're thinking about mums, we've spoken a lot about sort of while they're incarcerated, but it's very challenging for parents when they come out and they're on probation. what do we know about, these parents who often seem very overlooked? So I know we've discussed a bit about
Yeah.
how challenging it is. But yes, what does sort of some of the research tell us about how these parents fare when they leave prison?
Oh my gosh, we have such little research on this topic. I mean, I think we know next to nothing about women who are on community supervision, probation, parole. Most of the research that's been on reentry has really looked at men reentering and the tremendous challenges that men experience. We know very, very little about reentry and moms and their babies. There is like a whole lifetime of work that has to happen to know more there.
I was reading something recently that I think really stood out to me, which is that the research so often looks at recidivism rates, but overlooks a lot of positive indicators of lifestyle improvement, right? So there could be a lot of gains that are happening, but really all we're interested in is whether that parent returns to prison, which is not the only metric that really matters in that parent-child dyad or just sort of across the board for their quality of life.
Yeah, what would be success of the criminal legal system, right? If we have incarcerated someone and we think about, okay, they've been punished and served their time, what would be the ultimate goal of when we release them? What do we hope as a society, as a country, as a world, right? That people who have left prison are
Reformed, they're better.
right, better, healthier, more whole,
Yeah.
more connected, you know, more likely to stay sober. I'm not sure. I think we have to move beyond this like the lowest bar ever, which is like, do they come back to prison?
Yeah.
To me, that feels so short-sighted in terms of what we hope for people who have experienced the system, and in large part because like is that really all that we can expect for a multi-billion dollar system that we're investing in every year in this country? I guess I have higher hopes for how we spend our tax dollars.
Yeah.
Absolutely. I was wondering, what's the next 10 years look like for the doula program? What's in the process? Where does it go from here?
I think the next 10 years is making sure that there is no one in this country that births alone, right? That ensuring that every pregnant person in every state prison and every jail has access to birth support. I think that it looks to massive reductions in any pregnant or postpartum person even being in prison, right? So decarceration of this particularly vulnerable population. I think it looks like taking the lessons learned from what we have learned regarding the care and treatment of pregnant and postpartum women and expanding it to thinking about, but what about moms with young children? But what about dads with newborns? But what about parents more generally? And so I hope we can learn some things about these moms and their very young babies that provide some critical lessons to think about. Wait a second, there are millions of parents every day that are separated from their children. What do we need to know about visiting policies? What do we need to know about care and treatment? What do we know about, caregiver instability? How do we support people in community so that they don't come to prison? I think that there are some really important lessons that we'll learn in the next decade. And I hope, right, that we do get to that point 10 years from now that no one is birthing alone in this country and that is unacceptable. That it would be unheard of to have any state in this country where there are still pregnant people that are chained to beds and giving birth alone.
It nearly feels like a human right, isn't it, to not be chained to a bed as you are delivering
It seems pretty
labor,
basic.
in labor, I should say, not delivering.
Yeah. Yeah, with the birth trauma inquiry just coming out of the UK, and we have one in Australia as well recently in New South Wales, I believe. And that's just, sort of provided in community, right? That's state-based care. And I can't imagine if the rates are like, 1 in 10 or something in communities, what the rate of traumatic births is like in the prison setting. It's shocking to think.
Right. It's stunning. And I think we have so much more work to do. It is a human rights violation. The shackling, the restraint, the strip searching, those are all human rights violations. And I mean, I think that there is tremendous progress that has to be made around the clear and equal and human treatment of women and birthing people. We just can't accept that this is acceptable.
I really love that holistic lens that you want to support mums in the community before they're incarcerated, after, and that is so crucial to the, health of women broadly. You can't just be focused on, as you said, prison system that reforms them. Suddenly these programs change, the projection of their life, which is just unrealistic. They need that long-term support. So I love that that's the focus.
I think sometimes we get some critiques at the program, and I respect the critiques around, we really should be working towards abolition. And I think, yeah, you're right. We should be working towards getting pregnant and postpartum people out, and most everyone that, this system is not working, right? Or it's, as many people say, working exactly as it was designed. I don't know that it's making us safer. I certainly don't think it's making us healthier as a community. I do wonder how do we hold this tension of changing the system and providing better care and treatment for folks who are inside today, while simultaneously working to make sure that there are supports in community so fewer people are coming in, and that when people are released, they're in a better position than when they came in.
I just had a final question. So I was looking up a little bit about your background, and I was wondering what your experience was like serving as a guardian ad litem, and
Yeah.
how that sort of has impacted your role in research and your current career path.
Yeah, it's a great question. I mean, I was a guardian ad litem when I was at a point wrapping up graduate school, where I think I was honestly having a sort of identity crisis. Like, I think graduate school will bring you to a point, for many, at a point where you think, I don't know anything. What have I done? Why have I invested this much time? And what am I good for? I think there's a lot of imposter syndrome. And I think for me, I was feeling this tremendous disconnection from my community when I was finishing my PhD. I think I was feeling like I was really craving the application of developmental science, the application of my knowledge and skills. And in Minnesota, that's a volunteer gig. It is a volunteer guardian ad litem, where we are responsible for advocating for children in juvenile court. So kids who have child protection histories, who are actively, who have child protection cases. Moms have attorneys, often older children have attorneys. Guardians are really supposed to be neutral third parties about what would be in the best interest of the child. I will tell you that experience was hugely, really life-shifting for me in terms of trying to think about what does the research say on the intersections of the criminal, legal, and child welfare systems, right? These were basically like court systems that were working in isolation of one another. Even when like the thing that brought the family into court like was the same instance, and it just had to work through two court processes. So imagine, for example, a case in which a mom has very physically harmed her child, right? So a pretty egregious physical abuse case. That might rise to a criminal charge of like malicious punishment of a child, is what the charge could be. But then they also open up a child welfare case. And I think that these experiences of being a guardian and being in court helped me make sense of like where these court systems are or are not intersecting with one another, and how families are often not served by these systems, and just gave me real insight into like, I think probably most interesting, the way we just sort of cookie cut programs or case plans on families without really looking at what the family needs, and how often both of the criminal, legal, and the child protection systems were just so reactive, right? There was nothing preventative, nothing upstream. It was already, the wheels were already in motion, and so much of it was just punitive and reactionary. And it's really shaped my thinking, particularly as it relates to the care of pregnant people, when we think about when child protection gets involved, how child protection gets involved, and where, again, are there alternatives for upstream intervention to make sure that families are not coming into the system because they've abused or neglected their child, or are, as in most cases, living in poverty and are not able to provide basic needs for their kids. And so it's radically shifted my thinking about other systems that fail families, and really made me think about the complexities for the moms that we work with in prison, because almost all of them have child welfare history. That's what I would add about that experience.
Incredible. Thank you so much for sharing that with us.
Thanks so much for having me. This was such a great conversation.